Guys, so I'm here today to discuss my case study on tuberculosis. And I have Jean here. Jean is a 45-year-old female patient that presents to the clinic today in response to recently testing positive for TB. Jean's a social worker and had recently been consulted for a homeless patient who needed her assistance. Now, Jean had seen this patient a month prior to this most recent visit and remembered that the patient had been coughing. So Jean asked him how he was feeling, and the patient informed her at that time that he had tested positive for the TB disease and had elected to not yet start treatment yet for whatever reason. So Jean immediately came into the clinic and decided to get a TB skin test as well as a TB blood test, both of which unfortunately have come back positive. And Jean is currently not having any symptoms, no fever, no night sweat, no nausea, no vomiting, no unexplained weight loss, no decrease in appetite, no chest pain, no shortness of breath. And I elected, when she had the skin test and the blood test on, I also elected to have some additional lab work done to include a CBC comprehensive metabolic profile, including hepatic and renal function testing, test her for HIV, I got a chest x-ray, a sputum smear, a bacterial culture and sensitivity test, as well as a pregnancy test. And Jean had all of that done 2 days ago and is here now for follow-up. Jean currently doesn't take any medications except a multivitamin every day. Very healthy woman. She is 68 inches tall or 172 centimeters tall, 132.2 pounds, 60 kilos. Her BMI is 20.1, which is normal. She does not use alcohol, never has, no illicit drug use, and does not smoke. Her past medical history is unremarkable with no chronic illnesses. Past surgical history involves a lateral meniscus repair in 2010 after a skiing accident. Activity level, she does exercise frequently, at least 5 times a week, alternating aerobic and resistance training. Her blood pressure today is 120 over 68, heart rate of 72. Her O2 sat is 100% on room air, 17 respirations per minute. Her temperature is 98.6. And today I'm going to go over Jean's lab results, let her know that all of that's normal, but we'll take it from there. So, Jean, you're here for your follow up today because you've recently tested positive for tuberculosis. So,
I just don't understand that though, because like you said, I don't feel sick. I don't have any symptoms. So
right.
what does that mean?
What that means is how it spreads is a person with TB disease, and there are a couple of different designations, we'll go over that, but a person with TB disease has active bacteria in their system, in their lungs, in their throat, and they can cough, laugh, sing. That bacteria gets released into the air into little tiny micro droplets. And somebody unsuspecting breathes in that bacteria, and that bacteria is then displaced into their system.
But I was all the way across the room from him.
Unfortunately, when you are around somebody with active TB disease, tuberculosis disease, when they cough, laugh, or sing, those little droplets can actually hang out in the air for hours at a time. So it's unfortunate, but that's how this happened. And because he had not started treatment, that's pretty much, I think, how you were exposed. I can't imagine there would be another manner. Now, I do have to be upfront with you because this disease is so virulent in the United States. There are probably over 9,000. I know there were over 9,000 cases reported in 2018. I haven't gotten the data yet back for 2019. Hopefully it's decreased, but this is a reportable disease to the local healthcare department officials. So I did have to report that. I just want to be upfront and transparent about that with you.
Okay. But so where do we go from here? I mean, do I have to do the whole locked in my house with a bubble or?
No, not at all. Because you have tested positive for the tuberculin bacteria, but you do not have symptoms, you're being diagnosed with what is called as latent tuberculosis infection. It's different than the disease in that the bacteria are in your body, but it's not active. So you don't feel sick. You are not able to spread
So
this
I'm not going to get my
bacteria.
family sick.
No, not at all.
Okay.
Not at all. But the reason why we treat latent TB infection is someday this bacteria may become active. It will make you sick. And number one, we don't we want to prevent that because TB can affect more than just your lungs. And it can do permanent damage to your lungs, but your stomach, your spine, your brain, your kidneys. TB can affect all of that. And it's just a really horrible disease. So, number one, we want to try to prevent that from eventually happening. Number two, of course, we want to try to prevent the spread of tuberculosis bacteria. So that is why the CDC recommends that we treat latent TB infections. Now, again, I cannot force you to do this. This is the research I have done. These are the recommendations coming from the Centers for Disease Control.
Okay.
So,
Well, I'm up for doing whatever it is we need to do to make sure that this does not become a bigger problem for me or for my family.
okay, sounds good. So I did a physical exam on me and everything was normal. Lung sounds were clear. Chest x-ray came back completely normal. Good kidney function, good hepatic function. There were no abnormalities on this physical exam with the exception of her positive TB skin test and the blood test again. Just a little recap there. So, Jean, what I would like to do is start you on a 12-week program of two medications, and you'll take them once a week. So it's not a difficult regimen. The medications are generic, so that does keep the costs down. And I know you have insurance. However, we still like to prevent you from
Yeah.
dumping a lot of money into something like this. So the two medications are called isoniazid and rifapentine. And these fall into a class of medications known as anti-tuberculin agents. Sometimes they have side effects, and we'll go over that. Now, the thing about TB bacteria is that it grows very slowly, and that's why this program is stretched out so long. There are longer regimes for anti-tuberculin medications. There are lots of different anti-tuberculin medications. The reason why I chose these two is because the CDC has found that patient adherence is much better for treating tuberculosis when you keep the regimens very short, very neat, and very clean.
Okay.
So now, again, you'll take these medications once a week, and I will need to see you once a month. So I know that's a hassle. However, tuberculosis requires close follow-up. So, and these medications require very, very close follow-up. So it's very important that you adhere to the prescribed medication regimen.
And I understand that. As a social worker, I'm talking to people about their meds all the time.
Exactly.
So I get it.
That's excellent. That's excellent. So also, the medications interfere with numerous other medications. So before you start anything, even an over-the-counter cold medication,
Okay.
I need you to contact our office so that I can do a medication check. And you can even contact a pharmacist. They're great about doing medication interaction checks. So not even cold medication. I want you to be sure
So
to
take
call us.
nothing without calling first.
That is correct,
Okay.
because they can be so interactive. Also, regarding the side effects, now
Yeah, what are we talking here?
Okay. Um, they can change the color of your urine, your sweat, and your tears, turn it kind of an orangey color.
Hmm,
If you wear contacts,
I don't. We're good.
okay, good, good, because it can actually stain your contacts.
Oh, how fun.
Yeah, I know. So the medications can cause nausea, vomiting, diarrhea, bone pain, loss of appetite, rash, gastric upset in general, elevations in liver and kidney enzymes, anemia, acne, lowered ability to fight other infections, tooth staining, as well as the contact lenses, the urine that, yeah, I know. They also may cause more serious side effects like liver failure, um, serious intestinal infections like Clostridium difficile, C. diff. I know you've heard of
Oh,
that
yeah.
bacteria.
That's a good
That's
time.
yes. Um, Psychosis, life-threatening allergic reactions such as anaphylaxis, and should you have any of these reactions, again, I want you to call me because we need to keep track of these. I want to make sure that you're doing okay. We'll do monthly lab work to ensure that your kidneys and your liver are still functioning appropriately. I do want you to avoid alcohol while you are taking these medications. I
Oh,
know
wow.
you don't
Not a
drink,
big drinker.
so um, they can affect the liver, and I'd rather you not get into problems with that. Also, you're going to, if you are on birth control, like oral contraceptives that contain estrogen,
No, but I have an IUD.
okay, you will still need to practice with another form of birth control, a barrier method,
Okay.
while you are taking these medications because they will render some contraceptive forms inactive.
Okay.
So now, when you are taking the medications, there are some recommendations. Now, the and your pharmacist will go over this with you. However, I want to reiterate that isoniazid will be taken 1 hour before or 2 hours after a meal. The
Okay.
rifapentine you want to take with your meal. Food actually helps the absorption of rifapentine. The isocyanide you want to take with no food on your stomach.
Does it matter if I take it at night or in the morning? Like
No,
which
it
meal?
doesn't.
Okay.
You need to take it at the same time every day, though.
Okay.
Both medications, same time. At whatever day of the week you choose to take your weekly dose, it needs to be the same day or the same day of the week the next month.
Okay. Same
Now,
time of the weekday too, or no, just the same day?
we recommend it because it's easier to remember.
Okay.
However, I've printed out some medication charts that you can check off and maybe keep posted on your refrigerator or on your bathroom mirror where you can see them and you've got a reminder, okay, this is the week that I need to take my medication.
Okay.
I also printed out some information on the medications and the side effects, just so you could have that to read over in addition to what the pharmacist will give you when these are filled. Now, I have called these medications into your pharmacy, and I only call in a month at a time. That ensures patient adherence to your follow-up appointments because, again, we are going to have to be drawing lab work on a monthly basis. And as soon as I get that lab work back and your kidneys and your liver are functioning okay, you're not anemic, I'll call in another prescription to the pharmacy. We're good to go. So
Okay.
now I know we have already scheduled you for some follow-up appointments, and a lot of patients have to undergo direct observed therapy for TB to make sure that they take their medications. They will actually come into their health provider's office and take the pill in front of a healthcare provider so that it can be witnessed and that there is documented adherence to the medication. I do not feel that is necessary with you. So,
Thank goodness.
I'm going to send you on your way with this, but I know that you'll be compliant in taking these medications. So
Oh
you
yeah.
do not need observed therapy. And I'm going to go ahead and give you some, I've got a patient handout on tuberculosis, but I also printed out some information from the CDC regarding the most recent recommendation for the 12 dose regimen of the rifapentine and the isocyanib, as well as a medication tracker sheet and some side effects to watch for. Again, if you have any of these, I want you to call me, but here's a little checklist of what you need to look for. And if you're having these, call me. My phone number's on here. You can get in touch with me at any time. So, do you have any questions?
Nope. I think let's just get started so we can get done.
Okay, well, thank you so much. I appreciate you following up today.
Thanks.